everyone. My name is Samantha Willins. I am the Diabetes Prevention Program Specialist here at Holy Cross Health. I'm excited to be here today to talk with you about prediabetes, the Diabetes Prevention Program, and how you can join. So first we'll talk about prediabetes. So prediabetes means that your blood sugar is a little bit higher than normal, but not high enough to be diagnosed as diabetes. Your hemoglobin A1C level is between a 5.7 and 6.4%, or your impaired fasting glucose level is between 100 and 125 milligrams per deciliter. So if you don't know your numbers, I would recommend talking to your healthcare provider. In the meantime, you can go to the CDC website and take their prediabetes risk test. So who may be at risk for prediabetes? You may be at risk for prediabetes if you are 45 years of age or older, you have ever been diagnosed with diabetes, or if you have family history, of diabetes, if you are overweight, if you engage in little to no physical activity, if you have ever been diagnosed with gestational diabetes during pregnancy, or if you've given birth to a baby that weighed greater than 9 pounds. So why are we focusing on prediabetes? Well, prediabetes affects 88 million Americans. That's 1 in 3. What's also shocking is that 9 out of 10 people with prediabetes do not even know they have it. So without an intervention, up to 30% of people with prediabetes will develop type 2 diabetes within 5 years. It's just shocking. So why do we want to prevent diabetes? Diabetes is the 7th leading cause of death in the United States, and that affects about 34 million Americans. Having chronic high blood sugar can also lead to other serious health consequences, such as stroke, blindness, heart disease, kidney failure, loss of limbs, legs, toes, feet. So that's why we're very passionate about the Diabetes Prevention Program and working with our patients to reduce their risk for diabetes. So a little research behind the National Diabetes Prevention Program. The Center for Disease Control and Prevention, they conducted a research study where they randomized participants into 4 different groups. The first group was the lifestyle intervention group, and this group received intensive instruction on healthy eating, exercise, and behavior modification. The second group was the metformin group, and they took the commonly prescribed medication called metformin, and they also received just some light information on healthy eating and exercise. The third group was the placebo group, and they took a sugar pill as well as received some light information on healthy eating and exercise. There was a 4th group that received a different medication that got dropped throughout the study due to some serious side effects. So, the results of the study showed that first group, that lifestyle intervention group, was the most effective at reducing the participants' risk of developing type 2 diabetes. So much so that it cut their risk in half. So now I'll talk a little bit about the program we have here at Holy Cross Health. We call My Body, My Health. This is a year-long program because it's not a quick fix or just a fad diet. You learn to make changes that you need in your life in order to live a healthy life. So the focus and the goal of the program is to just increase mindfulness and to create lasting habits that will stick for a lifetime. So far, we are in year 3 of the program here at Holy Cross Health. We've started 48 different groups, and we've had about 650 participants, and collectively our participants have lost about 4,000 pounds, which is great, very good. Our program first started just with about one lifestyle coach, and now we have expanded. We have a group of 10. So we're only continuing to grow, which is fantastic. So now a little bit about the structure of the program. So like I said before, it is a year-long program. We have 3 different options for the program. The first option is in person. So you would meet here with a group at Holy Cross Health. I want to let everyone know that option is still on hold because of the coronavirus pandemic and physical distancing guidelines. So if this is an option that you're interested in, you can let us know and we'll put you on a list to be contacted once we can resume these groups again. The other 2 options are online. So the first online option, we call it our distance option. And this option, you meet with your group on Zoom, which is a video conferencing platform a lot of us have started to become very familiar with in the past few months. So the first 16 weeks of the program, you meet with your group on Zoom once a week. And the sessions are about an hour long. The next 2 months, you meet with your group on Zoom every other week. And then the last 6 months of the program, you meet with your group on Zoom just once a month. So you get a lot of great information, materials, and tools in the beginning. And then you can see it spreads out as time goes on. So you can go out, start practicing and implementing these skills you've learned, but then still come back to the group for support. Our other online option is we call our virtual option. And this option, it's a little bit more flexible and independent. So a new session gets released online once a week for 16 weeks. So with this, you have the entire week, whenever, wherever you want, to log in and look over that session's materials. The rest of the program, the sessions get released just once a month. So then you have the entire month whenever you want to log in and review the session's materials. You still have contact with your trained lifestyle coach who will be checking in with you and answering any questions you have throughout the program. So if you're interested in joining the program, you can either give us a call. Our number is 954-383-9419, or you can send us an email at dpp@holy-cross.com.
So, are you open for questions now?
Yeah, if anyone has any questions.
So we have a few that were submitted earlier. If I do the online class but I have to miss a session, is there a way to make it up?
Yeah, so that's a great question. It's asking if you have to miss a session, can you make it up? And the answer is absolutely. We understand life, vacation, things happen. You have to miss a session here and there. You just let your trained lifestyle coach know, and they'll be able to schedule with you a makeup session so you will still get all the information that you missed.
And if for some reason you're not able to join the classes, can you offer some tips for what we can do today to help us prevent diabetes?
So the question is asking, if you can't join the group, what can you start doing today to try to prevent diabetes? So it's a big answer, a big question. I would say just start being more mindful of the types of foods that you're eating. Try to make sure that you're increasing your physical activity. So you're getting at least 150 minutes a week of moderate activity or more. You can also, we do have our Facebook page called My Body, My Health, Be Fit is a group, and My Body, My Health, Eat Well, which is another group that offers some healthy eating tips, recipes. So if you want to search that, you can go on there and get some additional information.
Okay, all right, so we can close out and talk about next week's lecture.
Okay, so please tune in next Thursday, which is the 20th, and Dr. Ryan Kunstad, who's an endocrinologist with Holy Cross Medical Group. He has offices in Coral Springs and Fort Lauderdale, but he will be the presenter for next week.